Okay, so in this video, let's have a look at the appendicular skeleton. And remember, the appendicular skeleton consists of the long bones of the arms and the legs, and the girdles that hold them to the axial skeleton. So, in other words, the appendicular skeleton is going to include the shoulder girdle, which holds the upper extremities, and the pelvic bones, the pelvic girdle, which will hold the lower extremities. Okay, let's have a look at the shoulder girdle first, or it's often called the pectoral girdle. It's going to be composed of two sets of bones, so 4 bones in total. You're going to have the clavicle, we'll have one on each side, a left and right, and you'll have a scapula, which is going to be also left and right. So the clavicle is commonly called the collarbone, is on your front side, the anterior part, and the scapula is often called the shoulder blade, which would be on the dorsal or posterior part of the body. Now, the clavicle joins between the scapula and the sternum. It's a bone that's a little bit small, and it fractures. It's quite commonly broken. I'll let you guys think about that, but I'll give you a hint. Think about what kind of pressure can happen if you get slammed from the side. So if somebody hits you on your shoulder, your arm, think about where the forces are going to go, and think about that clavicle bone. Okay, if we think about the scapula, scapula is a large flat bone, and we break it down into a couple of different sections. It's got a spine on the posterior. It's a raised ridge, of course, and these areas, most of the shoulder blades are actually going to be attachment sites for muscles, and those are going to be known as fossas. There's a section called the acromion, and this is a process off the bone that helps join the clavicle. And then there's a shallow socket below that acromion that we call the glenoid cavity. The glenoid cavity is going to help accept the humerus bone, so it's going to help hold the upper bone of the arm into place. So here's a look at a posterior and anterior look at the shoulder girdle. We can see the acromon right here. So this is going to be the scapula. Sorry, this is going to be, yeah, the clavicle, sorry. And the acromon connects the clavicle to the scapula on the back. So here's our scapula. Right here in this space right here below the acromon, we get the glenoid cavity, and that's where the humerus, so that's the bone of the upper arm, is going to join in and be held into place against the appendicular, against the axial skeleton. So the important, you guys should be familiar with both the scapula and the clavicle, and you should also be familiar with the role the acromon and the glenoid cavity play. Okay, the upper extremity, or in other words, the arm, are going to contain about 30 bones each. Okay, the major one, the biggest one, is, of course, is going to be the humerus, and then at the lower arm, that's when we start to get into smaller bones, when we get into many more of them. The forearm is going to consist of the ulna and the radius, and you should have a note of the olecranon, this area here, and the trochlear notch, which is going to be on top of the olecranon, so right up there like that. Have a look at those, and we'll come back to those in a couple of seconds. Below the radius and ulna, we're going to have the carpal bones. There's going to be 8 of those, and those are going to make up your wrist. Then we have the metacarpal bones, and those are going to be the long bones of your hands. And then finally we have the phalanges, which make up your fingers. So let's have a closer look at the upper extremity. We'll start off here with the humerus. Now the olecranon fossa that we talked about, or the olecranon we talked about in the last slide, and the radial fossa, this is going to be places that articulate with the radius and the ulna, and we'll have a look at that when we come back and have a look at the elbow joint in a little while. So here's our elbow joint. This is our humerus coming down from the top here, and we can see the head of the radius, and it fits into the trochlear notch right here, and then the olecranon, which is going to hold and help keep the humerus in place. This is also going to be some attachments for some muscles, of course, so that we can have a little bit more articulation and movement in our arm. Alright, when we get further down the hand, we find, or the arm, we find ourselves down to the wrists and the hand. Now, our hand, the construction or the organization of our hand and wrist is very similar to what we're going to see with our ankles and our feet. Okay, so you're going to see a very similar but slightly different organization when we start talking about the lower extremities. So, as you can see, we've got the ulna and the radius, and if you get them mixed up, then the radius is going to be at your thumb. And that didn't come out too well, but anyways, the base of the radius connects with your thumb, and the radius radiates above the ulna. So that's one way to remember the radius, the difference between the radius and the ulna. Now, these next group of bones right here, these are going to be your carpals, and you can see that there's 8 different carpals, and they all make up the articulation of your wrist, so it allows your wrist to have that range of motion that it does, which is quite different than most joints in the body. I don't expect you guys to remember all of the carpal bones, okay? Know that the carpal bones, there's 8 of them, and they make up the structure of your wrist. The next set of bones are the long bones of the hand, so these are going to be in the skin within your hand, and we call those metacarpals. You have 4 for your fingers and 1 for your thumb. And then once we move away from the metacarpals, we get into the phalanges. So the phalanges make up the bones of your fingers, and we just characterize those as the based on the anatomical term. So you have the proximal phalanx, which is the one closest to the metacarpal. You have the middle one, which of course is in the middle, and then finally the distal one, which would be out on your fingertip. So you guys should know that, the phalanges and the metacarpals, the radius and the ulna, but I don't expect you guys to know all the bones of the carpals. Okay, so that's a look at the upper extremities. Now let's have a look at the pelvic girdle and the lower extremity, or the legs. Now, first of all, the hip bone that we've been calling in lab is made up of 3 bones that eventually fuse together. So you have the ilium, which makes up the big part of the hip that you can, if you actually touch, if you push yourself on the side. You have the pubis bone, which makes up a huge part of the joint for where the femur joins in. And then you have the ischium, which basically makes up your backside. So you actually, when you sit down, you'd sit down on your on the ischium. So those 3 bones fuse together to form the pelvic bone or the hip. Now, along with the sacrum, which of course are fused vertebrae towards the base of the spine. Now, this is one of the major differences. There are differences between the male and female skeleton. Generally, they come down to a ratio or a size ratio when you compare different measurements, but the major difference between a male and a female skeleton occurs with the pelvic bones. Okay, we have the female on the right over here, and then of course we have the male over here on the left. If we look at the bones, you can tell there's a little bit of there's a difference just by the differentiation. The male hip bones tend to be longer, whereas the females tend to be wider. Okay. Another thing that's significant is the degree of the pubic arch. So that's the difference in the ischium bones. The pubic arch in the female tends to be a lot wider than the pubic arch in the male, as well as the pubic outlet. And the pubic outlet is the big space between the hip bones here. You can see in the male it's quite slim, and in the female it's quite wide. And that helps accommodate during childbirth. It's easier for the baby that has to be born if there's a bigger space for it to pass through. So having the wider construction, the wider organization, that gives the female generally a wider hip, as opposed to the males, which tends to be longer and a little bit slimmer in design. If a body was discovered and only the skeletal remains were found, so we couldn't tell based on skin what the gender was, these would be the bones that the person would look at in order to tell if it was a male or a female. Okay, so that was the hips that make up the pelvic girdle. Now we're talking about the legs, which are going to make up the lower extremity. Very, very similar design to the arms. Of course, it's these legs are bigger and they're longer, and they're a little bit more robust. We have the femur, which is the biggest bone in the body. That's your upper leg bone. And there's a few things about the femur that you guys should take notice on. You're going to have, first of all, the greater and then the lower trochanter. And these are going to be places for muscle attachments. The biggest muscles we have in our body are going to be quadriceps, which are the muscles that surround the femur. So we need to have significant places for muscles to attach. If we come further down, distal on that bone, you're going to see the lateral and the medial condyle. So the medial is going to be towards the inside of your leg, and the lateral one will be on the outside, of course. And these are going to be articulating surfaces for the joint at the knee. Okay, so this is where we're going to have contact with the fibula tibula. And then we also have the kneecap, which is the patella. So looking back down, again, these are going to be the lower bones of the leg. You're going to have the tibia and the fibula. The tibia is the bigger bone out front, so that's going to be your shin bone. So if you've ever walked into something, the tibia is the one that you've smacked in your leg into, that causes the pain. So that's going to be the bigger bone, the tibia. And you can see the tibia is going to be where we get most of the articulation with the femur at the anterior end. That makes up the knee joint. Now, right above this, you're going to have the patella, which is kind of a diamond shape or a square shaped bone that'll sit between the femur and the tibia that helps make up the knee joint. If we go further down, you'll see that the fibula, that extends more distal than the tibia, and that makes up the bone that's on the side of your ankle. So if you reach down, you feel your ankle, and there's a bone that sticks out. That's going to be the lateral malleus of the fibula. Okay, now if we have a look at the foot, we're going to have a very similar design as the hand, except the bones are a little tiny bit different, of course. You're going to have, first of all, the tarsals, which are going to make up your ankle bone. Okay, these bones are going to be bigger than the carpals. They're going to be a little bit more robust because they're going to handle generally a lot more weight, because every time you put your foot down, you're going to be bearing weight on these bones. So you can see there's 7 bones there of the tarsals. Again, I'm not going to expect you to remember those, but I would expect you to remember the metatarsals, which are going to be the long bones of the feet, and the phalanges. And the phalanges, of course, are going to be, we would name them exactly as we did on the hands, where we'd have the proximal and distal. In this case, for most of our big toe, we only have 2 phalanges, and then for the other toes, we have 3 phalanges. Alright, so that's the end of this video for the appendicular skeleton. In the next video, we're going to be talking about some of the disorders of the bones.